Hey, frontline defenders of mental health. So, have you ever cared for someone who hears voices, fears they're being followed, or struggles to distinguish reality from delusion? You may be caring for someone with schizophrenia, a complex chronic psychiatric disorder that demands both clinical expertise and deep compassion. Let's unpack what it is, what causes it, and how nurses can play a life-changing role in care. Schizophrenia is a chronic psychotic disorder marked by disturbances in thought, perception, emotion, and behavior. It typically emerges in late adolescence or early adulthood. Symptoms fall into three major categories. Positive symptoms are things added to behavior. These include hallucinations, which are often auditory, delusions, meaning false, fixed beliefs, and also disorganized speech and behavior. Now, negative symptoms are things taken away. These can be a flat affect, anhedonia, which is a loss of pleasure, social withdrawal, and avolition, or a lack of motivation. So, let's talk about cognitive symptoms. These are, honestly, some of the most subtle but also pretty disabling symptoms of schizophrenia. People might notice poor concentration, memory problems, and impaired executive functioning. These issues can make daily life and decision-making a real challenge. Now, moving on to the causes of schizophrenia. It's a mix of genetic, neurochemical, and environmental factors. There's a strong genetic link. Your risk really goes up if a first-degree relative has schizophrenia. Dopamine dysregulation plays a role too, with overactivity in the mesolimbic pathway contributing to positive symptoms, and underactivity in the mesocortical pathway leading to negative or cognitive symptoms. Brain structure changes, like enlarged ventricles and reduced gray matter, are also seen. And of course, environmental triggers such as prenatal infection, early trauma, or substance use can increase risk as well. When it comes to treatment and pharmacologic management, antipsychotic medications are really the cornerstone here. There are first-generation or typical antipsychotics like haloperidol and chlorpromazine. Then there are second-generation or atypical antipsychotics such as risperidone, olanzapine, and clozapine. These medications help manage positive symptoms, and the atypicals are usually preferred because they tend to have fewer extrapyramidal side effects. So, adherence is really critical when it comes to treatment. A lot of patients actually relapse because they end up stopping their medications. Long-acting injectables can sometimes help improve compliance, which is pretty important. And as adjuncts, we're talking about things like antidepressants, anxiolytics, and of course cognitive behavioral therapy or CBT. Alright, let's talk nursing priorities. It's essential to monitor medication effects closely. You want to watch for extrapyramidal symptoms, or EPS, which can show up with certain meds. Also, make sure to assess for metabolic syndrome, so that's checking things like weight, lipids, and glucose levels. And don't forget to check for any signs of neuroleptic malignant syndrome, or NMS, since that's a serious concern. So to create a therapeutic environment, it's important to use clear and simple communication. You want to avoid arguing with delusional beliefs and always maintain safety and structure for everyone involved. Promoting activities of daily living and self-care means supporting hygiene, nutrition, and sleep hygiene. Encouraging routine and structure really helps patients feel more secure and independent. Patient and family education is huge. You need to explain the importance of medication adherence, teach about early signs of relapse like social withdrawal or insomnia, and connect everyone with community mental health resources. Schizophrenia can shatter reality, but with steady care, structured support, and nursing vigilance, patients can regain control and live meaningfully. So, how do you build trust with patients experiencing psychosis? Drop your strategies in the comments. And don't forget to like, subscribe, and follow for more psych nursing content, because every breakthrough starts with belief. And remember, listen, stabilize, empower recovery.